Hello everyone, my name is Samantha Burgess, and in this video we will discuss the anatomy, physiology, and common pathologies of the aorta. Here's what will be covered in this video. In the anatomy section, general information about the aorta will be given, along with information regarding its different layers and sections. From there, we will talk about the function of the aorta. After building this foundation, 3 common pathologies of the aorta will be discussed. These include aortic dissection, aortic stenosis, and aortic aneurysm. Let's get started. Alright, first let's talk about the anatomy of the aorta. But before getting into all the details of its structure, we need to make sure we have a clear understanding of what the aorta is. The aorta is the main artery in the body that delivers oxygenated blood to the circulatory system. It begins at the left ventricle of the heart, passes through the abdomen, and ends at the aortic bifurcation, which is usually around the level of the 4th lumbar vertebra. Significant aspects of the aorta include the composition of the aortic wall and its different sections. The aorta is made up of 3 layers: a thin inner lining called the intima, an elastic middle layer called the media, and a thin outer layer called the adventitia. The lumen is the central cavity of the aorta where the blood flows. Specifications are made in regards to where the aorta is located in the body. The aortic root is where the aorta meets the heart. From there, the aorta ascends into the aortic arch, which is easily recognizable. The thoracic aorta is the portion following the aortic arch and preceding the aorta's passage through the diaphragm. This section can be located from about the 4th thoracic vertebra to the 12th. In line with the 12th thoracic vertebra is the aortic hiatus, where the aorta passes through the diaphragm and becomes the abdominal aorta. As mentioned previously, the aorta ends at the aortic bifurcation, where it splits into the right and left common iliac arteries. From every other section of the aorta, arteries branch off as well to supply oxygenated blood to the rest of the body. Some that are worth noting can be seen in this picture. Starting superiorly, moving inferiorly, there are the common carotid, the brachiocephalic, and subclavian arteries branching from the aortic arch. From the thoracic aorta branch several intercostal arteries. Lastly, from the abdominal aorta, you can see the celiac trunk, the gastric, splenic, and hepatic arteries, the superior mesenteric artery, renal arteries, the testicular or ovarian arteries, the inferior mesenteric artery, the lumbar arteries, and at the very end, the common iliac arteries. All of the previously mentioned arteries do branch out further to supply the rest of the body. Now that we know the structure of the aorta, let's discuss how it functions. The most important function of the aorta is to deliver oxygenated blood to other circulatory vessels that will then distribute the blood to the rest of the body. This is accomplished through the forceful contraction of the left ventricle, sending blood through an opened aortic valve to then reach the aortic arch and continue from there. The makeup of the aorta we discussed previously allows it to be elastic and flexible. This is an important aspect of a functioning aorta because it allows the aorta to stretch when experiencing pressure, but return to its normal state. It may seem as though the aorta serves a fairly simple yet extremely important purpose, but like any other area in the body, things can go wrong. Although rare, pathologies of the aorta can occur. Through my research, there seem to be 3 that were worth noting here. The first one we'll discuss is aortic dissection, which according to Baumann is the most common acute aortic disease, but the incidence is presumed to be underestimated. Aortic dissection is a sudden tear in the wall of the body's main artery. This tear can occur at any location of the aorta, but is most common where there are any irregularities in its path. As horrible as this condition is, it is understandable. The aorta experiences blood surges that have exited the heart with immense pressure. This occurs about 70 times in 1 minute. In cases of aortic dissection, a tear of the intima will continue to be pried up by the blood flow, further separating the intima from the rest of the aortic wall. When this happens, blood is redirected from its normal path in the true lumen and begins to flow through the false lumen. Over 90% of those who don't receive prompt treatment will die. The next pathology we will discuss is aortic stenosis. Aortic stenosis is the narrowing of the aortic valve opening, therefore restricting blood flow from the left ventricle to the aorta. Symptoms include pressure buildup in the heart, shortness of breath, fatigue, chest pain, and fainting. Open heart surgery can be the course of treatment to replace the faulty valve, or an Edwards-Sapien transcatheter heart valve can be used and delivered via the femoral artery. In 2009, when this treatment was in phase 3 of their clinical trials, Dr. Martin Leon reported on the success of the treatment by stating, "What impresses me most is that when we see these patients in follow-up, the magnitude of improvement is staggering." The final pathology we will discuss is aortic aneurysm. According to Dr. Schermerhorn, most people with aneurysms are not going to die from them. There are many more that are small than are big. While this is comforting to hear, large aneurysms can occur and they can be very serious, especially if they threaten to rupture. Aortic aneurysms are most commonly seen in the abdominal aorta and occur when the aortic wall becomes thin and weak. When this occurs, a bulging of the aorta can be seen. Normally, surgeries are not considered until the risk of rupture exceeds the risk of dying from surgery. The mortality of ruptured aneurysms is up to 80%. So, it is paramount to prevent a ruptured aorta. In the surgery, the surgeons use a catheter to place a stent, as seen on the right, around the bulging aorta to stabilize it. Obviously, there is so much more to learn about the aorta, and just from this little sampling, I was truly reminded of how mighty God is. This tends to happen a lot when I focus my study on any particular area in the realm of science, but this time around, I was simply amazed at the Lord's creation. It's just incredible to think about how each one of us are created in His image, and how meticulously we are created. The human body simply shouts His creation. Throughout this process, I was reminded of Psalm 139, 13 through 14, which says, "For you formed my inward parts, you knitted me together in my mother's womb. I praise you, for I am fearfully and wonderfully made. Wonderful are your works, my soul knows it very well." Thank you.